Well, if nobody else is going to say anything first, I just want to ask about compressive rings, or I think they call them pleasure rings now. They're sold over the counter, I saw. That's something
Yes.
that I usually recommend for people who don't have, like for younger people who are having erectile difficulties. Is that something that you recommend?
Yeah, I'll definitely recommend that from time to time. It's typically for men. When you meet men that have erectile dysfunction at an early age, it's very common from venous insufficiency or venous leak. So they have good blood flow into the penis, but they have too much blood flow leaking back out. That's also more common with Peyronie's disease. And it's a difficult problem to fix because if you have venous leak, there's really only three things you can do. You can try and overcome the leak by getting more blood flow into the organ, and that would be with our oral medications and our injections. You can try and reduce the backflow of leak by using a compression ring. Sometimes that works, sometimes it doesn't. And then lastly, you would move on to a penile implant. But the compression rings are certainly reasonable. You have to counsel patients to be safe with them. You don't want to fall asleep with it on because that could potentially constrict the penis too long and cause permanent damage. But if used like appropriately, it's generally a safe thing. It may not help, it may hurt. I mean, it may not help, but it's probably not going to hurt if it's used appropriately. It's very rare that erectile dysfunction is caused by one simple problem. It's almost always multifactorial. So it's lifestyle, it's diet, it's body weight, it's physical activity, it's genetic. It can be related to depression, anxiety. It can be related to your partner's willingness. And that's another thing that's incredibly important when you're managing sexual dysfunction is that the goals should be the shared goals of the patient and their partner. And it's really important whenever I see patients in the office, I always encourage them to bring their partner because it affects both of them. And understanding what the goals of the relationship, a patient may come in and I may simply think, oh, your goal is to be able to have a good erection. That may not be the goal. The couple's goal may be very different from that. And so it's helpful when both are present in the visit so we can talk about it. And I'll be the first to acknowledge that it can be a very uncomfortable conversation sometimes. I think my goal in all this is to make you feel relaxed, make you feel comfortable talking about it, and to be your advocate, be your coach, and help understand what your options are. But it always comes back to the basics, and prevention of erectile dysfunction is way better than the treatment, right? So the prevention comes back to all those things that we're talking about: maintaining a healthy body weight, regular exercise. I always tell patients to minimize processed foods in their diet as much as they can. Sodas, canned foods, frozen foods, things like that. We all have to do that from time to time. That's just the reality of the busy world that we live in. But to try and minimize that as much as you can. Sleep is an important one. I'm glad that's been added to the steps for a healthy lifestyle, because if you're not getting enough sleep or you're not getting quality sleep, I can tell you that in my practice, I probably send 4 to 5 guys per month to sleep studies, and the vast majority of them are diagnosed with sleep apnea. Sleep apnea will lower your sex drive. It will lower your testosterone levels. It can create more heart strain, which can lead to worsening high blood pressure and a whole assortment of other problems. So quality sleep is very important. I think it's worth having the conversation. Even though it's associated, it doesn't necessarily mean that every single guy who's on that medication has that problem. Medications affect everyone a little bit differently. And so it is a known risk factor. It doesn't necessarily mean that you'll have that side effect. For the sildenafil, it's 5. You can take a maximum of 5 of those. Is there a maximum number of times per week someone can take? So PDEs or phosphodiesterase inhibitors, those are the medications like the Viagra, Cialis, Levitra. So in general, some of them are designed to be used every single day, like daily dose tadalafil, the 5 milligram dose, that can be safely taken every single day. The other medications, Viagra, Cialis, Levitra, Stendra, they can really be taken on a daily basis. In fact, there are some patients who will take a maximum dose every single day. Now, that's not something I necessarily recommend, But there are patients that safely do that. The reason I don't necessarily recommend it are just because of some of the side effects associated with the drugs, specifically things like headache, facial flushing, sometimes low back pain, sometimes ringing in the ears or visual changes. But they're generally safe to be taken on a daily basis. We usually write them as an as needed medication or a PRN medication, but they can generally be used on a daily basis. They're pretty safe. One of the risks of taking them, whenever you see the commercials on TV for these drugs, they say, if you have an erection more than 4 hours, call your doctor or go to the emergency room. That's actually exceedingly rare with oral medications. With the PD5 inhibitors, it almost never happens. We're talking a 1 in 1,000 type of event. So I don't worry about that a whole lot. This kind of came up earlier. So generally speaking, the constriction bands or tension bands are safe as long as you don't fall asleep with one on there. And generally the reason that they work is because they prevent that venous outflow of blood. So you get good blood flow into the penis, and so that you don't lose the erection, it helps keep it in there. They're generally safe. There are, obviously you can buy over-the-counter ones. There are also medical grade ones. I don't think there's really a big difference other than cost. I don't think one necessarily works better than another. But if they're used safely, I would never recommend that someone left one on for more than 30 to 60 minutes. Because one of the potential risks is that if you have that constant compression on the penis, it could affect the blood supply. It could also affect the urethra. It could damage the urethra and cause some scarring in the urethra. Generally speaking, you want to take, so Viagra has a fairly short half-life, and you're going to hit max dose or max efficacy about 1 to 2 hours after you take it. If you really want to get the best possible result from these medications, the best time to take it is first thing in the morning, because there are two things that happen then. Number one is you've been fasting for probably 8, 10, 12 hours. So you don't have any food in your stomach. Number two is your body gets its biggest spike of testosterone throughout the 24-hour cycle around daybreak. So if you take that medicine around the time that you wake up, not only are you going to be doing it on an empty stomach, but you're going to have your highest testosterone levels for the whole day. So Viagra, they've been around the longest. They have the most data. They've been around since 1998. It works. We know it works. It doesn't work in everyone. You take it about an hour before intercourse. It has about an 8-hour half-life. So it's usually out of your system within about, 8 to 12, 8 to 16 hours. You're going to get the most benefit about 1 to 4 hours after you take it. Cialis has a longer half-life. And I don't know if you remember the old commercials they used to do for Cialis where they would have the couple and each one was in a bathtub and they were sort of holding hands. And the one thing that they always promoted was that it gave you more spontaneity in your love life. You didn't have to plan around things so much. Like, for example, let's say you have a nice dinner on Friday night. You take your girl out. You have a nice dinner. You take your medication. You get home. Who knows? Maybe something happened. Her sister called her. She's upset about something. I don't know. The dog ran away. Who knows? Next thing you know, your Friday night moment is lost. Well, you wake up Saturday morning, everyone's feeling different. She's feeling refreshed. That Cialis is still on board and it's still ready to go. So you have a little bit more spontaneity in your love life. Levitra, which is vardenafil, it in laboratory studies, so in vitro tests, it is the strongest of all of them. And it does have the worst side effect profile. There are some patients who might fail a trial of tadalafil, for example, which is Cialis, and then they may have a good effect with Levitra. Levitra, for whatever reason, never became that popular, but you can still write for it. One of the nice things about Levitra is for patients who have a difficult time swallowing, they do have a sublingual tablet that dissolves spontaneously. And so that's nice for some patients who maybe they have trouble swallowing. You also get a little bit quicker onset of action with that. And then last but not least, we talked a little bit about Stendra, which is Avanafil. And their claim to fame is that they have the shortest onset of action. So it starts working within 15 to 30 minutes. And then number two, it's not affected by food or alcohol quite as much. men's health is not just about treating erectile dysfunction and low testosterone. It's about identifying the diseases that are, some are specific to men, some are worse in men, and they can predispose you to other problems. Because I want you guys to live as long and as healthy a life as possible. Because my guess is everyone on this call is someone's son. They might be someone's brother. They may be someone's uncle. They might be someone's grandfather. You know, a lot of people depend on you. And so I want you to live a healthy and happy life as long as you can. And that includes doing things that are not only good for your sexual function, but are good for your heart and everything else.